Hello, everyone. I'm so happy to be back here. This is Executive Director Richard So from SF Hep B Free, and this is episode 15 of our YouTube series Living with Hep B, where we talk to folks who either are living with Hep B, tackle Hep B, or have worked with family members or friends around hepatitis B and liver cancer. And today I'm super excited for our guest, Dr. Sue Wang, who has had a long history with hepatitis B and advocacy and been a longtime friend of mine. And so, without further ado, I will pass it on to her to introduce herself.
Thanks, Rich. Thanks for inviting me. Exciting to be here and to have some time to really talk to you about Hep B and my journey. So, just as background, I am a physician. I'm an internal medicine doctor. My role is the medical director for the Center for Asian Health and Viral Hepatitis Programs at Cooperman Barnabas Medical Center, which is a hospital in New Jersey. We're part of the RWJ Barnabas Health system, and I have an affiliation with New Jersey Medical School. I'm also the senior advisor for global health with the Hepatitis B Foundation, which is a big nonprofit in Hep B, which you work closely with, I know too. And I'm past president of the World Hepatitis Alliance, which is a nonprofit NGO based out of the UK, whose mission really is to see elimination of viral hepatitis achieved by really harnessing the power of people living with hepatitis B, and that's for Hep B and Hep C. So yeah, and it's been great. I've definitely, enjoyed interfacing and working with you over the years. And, I'm glad you're doing this kind of like deep dives with people who work in the hepatitis B space. So fire away.
Yeah, and so for those listening, Sue has been a champion for so many issues around hepatitis B. And when she said World Hepatitis Alliance, that is indeed the large world group on hepatitis. So we were so great to have her be the president and help push hepatitis B work around the world. And so I think viewers would want to ask, well, how come this became such a big thing for you and in your career? Do you have a direct connection with hepatitis B?
Yeah, so I'll tell you my journey. It's going all the way back. So my parents are immigrants from Taiwan. My dad came over to do a PhD, and so like many people, we were children of immigrants. He settled in the U.S. and I brought my mom over, and so I grew up actually in the Panhandle of Florida, so in the deep South. And so it wasn't really, didn't have a huge like Asian community that I was a part of, but we had a decent number of like Chinese families that we connected with. And so it was a part of my identity, but it's not as if there was a huge community as if I was in New York or California growing up.
Hmm.
And then I went to school in Miami. I did a combined undergrad and med school program. And during college, I donated blood for the first time, and basically got a letter saying that it looked like I had hepatitis B, and that was the first time I'd ever heard about hepatitis B. Really didn't know what it was. Kind of panicked. Told my sister that she was still at home at the time, and I remember saying, "Oh, May, I got this." Her name is May because it's it's like May, but also became her name. And I said, May, don't tell our parents, but I tested positive for hepatitis
Hmm.
B. And she said, "Oh, didn't you know? Like, I think mom has it or something." Like, she had somehow heard through the family grapevine that there were some family members with it. And it turned out my mom actually didn't have it, but I had some other relatives, her siblings, who had it. And so, but I was like initially like so shocked, and I'd not been sexually active. I didn't know how I got it. And then once I found out that it might be through, some family transmission, then I was kind of like, oh, what do I do? Who do I need to tell? And I went to see my primary care doctor, who basically did some tests and said I was a carrier and not to worry about it. And we all know that that phrase has kind of come out of popular use because it gives people a false sense of security, right? That there's nothing
Hmm.
going on. And being somebody who was going down the med school track and healthcare, I I actually didn't know how it would impact me, but I was privy to
Right.
more knowledge than usual because than the average person, because I was kind of going down medical training. And it really didn't affect me too much. And I was lucky because I have now since heard of so many stories of people who are studying in healthcare where this spot does become an issue because you test positive
Yeah.
as you're doing screening, as your employee health screening. And there have been cases of people in healthcare, med students and other students who have been really discriminated against based on their status. And some people have lost acceptances to med school or gotten kicked out of training, or even had been unable to get licenses like dental license or practicing because of Hep B, which is obviously very discriminatory. So now looking back, consider myself lucky. Um, and so it didn't really affect me personally until, uh, I would say just like talking to people, trying to figure out if I needed treatment. At that time, I didn't. And then when I was in a relationship, like having to disclose to my boyfriend at the time, and then talking to my infectious disease doctors, like kind of realizing that he needed to be vaccinated. Those were kind of like the real life interfaces of
Hmm.
how having Hep B kind of impacted my personal life. But just in contrast, I think I feel very blessed that, my then boyfriend was like very supportive and fine with it. And, I didn't face any personal kind of stigma or discrimination, but we know globally this happens a lot. A lot of people face a lot of rejection, by people close to them. It could be family members, could be, people that they're dating or people in work. And so it does become a real burden, regardless of what your blood tests show, what's happening in your liver, there's a huge effect on how you see yourself and your relationships with other people. And so I do think it's important for those of us who can speak out to be really vocal about that, because a lot of people are
Hmm.
really afraid and scared, and there's a lot of negativity that they might feel with the diagnosis. And so it's helpful for them to hear that you can be in healthy relationships, and it's, how you have these conversations. And thank God with Hep B we've got a vaccine, right? So people can be protected, and once you're protected, you don't have to worry about transmission. And so there's a lot of hope, but it's hard to sometimes struggle through that if you don't feel like you have the tools. Um, so yeah,
Yeah.
I was fortunate, and I ended up, it definitely didn't occur to me that I would be doing this as like part of my career at that time. This was
Hmm.
really just kind of a personal thing I was dealing with. And honestly, I think a lot of people, you don't want to have to deal with this all the time. I think people just want to
Hmm.
get on their lives. And this is, part of the reason where people don't want to get tested or they don't want to get care, because it reminds them that they have this condition. And so, I think we have sometimes people put it on the back burner. They're like, I've got school to deal with and I feel
Right.
fine. And why do I want to see the doctor to get the blood tests if I feel fine? And So it wasn't necessarily something I was going to be a pioneer about, at that time. And
Hmm.
really only kind of, I guess I was really fortunate that in my career, I ended up studying public health. I did 2 years
Hmm.
at the CDC as part of this fellowship called EIS, which is called Epidemic Intelligence Service. And it's public health disease detective fellowship, which was really cool. And I had a really great time doing it. And so when I finished the fellowship, I was kind of at a juncture of like, do I go back to clinical medicine and see patients, or do I go kind of the public health route? And work at a health department or work for the federal government. And it ended up an opportunity. Somebody introduced me to a community health center in New York City, Charles B. Wang Community Health Center.
Hmm.
At that point, I was like, wow, there's a health center just dedicated to Asian people. Like, that's so crazy
Yeah.
to me. Like, coming from
Yeah.
Miami and
Hmm.
Pensacola, and then I was in DC for residency. It was just a crazy idea. But I really love the idea of being able to serve my community, And so I did that when I moved to New York City, and brushed up on my Chinese and really got
Hmm.
immersed in like what it meant to serve a community and see the unique needs that we have culturally, and how it impacts our health. And obviously there's certain diseases that are more prevalent in the Asian community, Hep B being one of them, but also cancer, like GI cancers, we're at a much higher rate of, and diabetes. We get diabetes at a lower BMI. So that was really cool for me to, I was learning from the community really at that point. And so as part of that, because Hep B was so common, the medical director at that time had said, "Hey, Sue, I know you've worked with the federal government and you've done, some population health. Like, I'd love to hand over our Hep B projects to you because I'm going to the White House." He went for a White House fellowship, and at that time, actually, I had been starting to get familiar with clinical care of Hep B, and it wasn't something I learned in residency. Especially since I was a specialist, I was a
Hmm.
primary care doctor, not a specialist. It was not something we had learned. So it became like what we often say in medical training is see one, do one, teach one. So
Hmm.
you learn from somebody else who's doing it. So I was learning from this guy who was also like me, an internist, Thomas Sang, who some people who will remember him from when he was at Charles B. Wang. But so he had become familiar with treating Hep B. So he became my kind of like mentor for that. So I'd see a patient and then like run things by him, and he would give me some advice. And this is super helpful as I became more and more comfortable in order to become more comfortable treating people with Hep B. But yeah,
Hmm.
it's a see one, do one, teach one. And then, I was able to kind of train other people who are primary care doctors at the FQHC to how to take care of people with Hep B. And this is really important. A lot of the work I do is actually about empowering primary care docs to provide Hep B care because a lot of people can't access specialists or they won't be able to follow up with them for various reasons. We have many barriers, language barrier, insurance barriers, people just time and logistics, not being able to take off for that many doctor's appointments. So that's how I really kind of became used to, learned the work of taking care of people
Hmm.
with Hep B. And then in New York City, we had very similar to San Francisco, like just a strong community
Hmm.
presence, people who are really trying to serve their communities. And the health department was really engaged. And we ended up having a Hep B coalition come out of like this kind of a mix of the community academic centers and also the health department wanting to do work. And part of that, they had a really strong relationship with the city council, and the city
Hmm.
council had funded a Hep B care program, which has evolved but is still ongoing and has provided navigation help for people and really linked people to clinical care. And as part of that, we were doing a lot of awareness building, like you guys do with World Hepatitis Day, and we have
Hmm.
city council. We do a lot of education of people who are policymakers, and we kept finding how that like it was really hard to get people to tell their stories, right? People with Hep
Right.
B,
Hmm.
like they're ashamed, but they're also like just busy, right? They just want to go on with life,
Live
right? They
their
don't want to bring
lives.
even
Yeah.
more attention, right, to the
Yeah.
fact that they have Hep B. And so we are always lamenting, like, we can't get somebody to share their story. People worried about, immigration status or
Hmm.
whatever, stigma. And I was doing a story for the CDC. They were doing interviews called Faces of Hepatitis. And at some point, I was being interviewed and I was really talking about what it was like taking care of people with Hep B. And similar to what I'm telling you now, like how important of a issue it is with such a high burden, and yet we're having a hard time getting people to speak. And I finally was like, oh my gosh, I should really just talk about the fact that I have Hep B myself,
How
yes.
about me?
But at that point, I had not been public about it. And part of
Hmm.
it, I've heard people say that too. They're like, I want to do the work without people thinking I'm doing the work because it affects me, right? Because
Right.
then you're like, it just kind of feels weird that like, am I doing this just because it affects me? You kind of feel like it takes away from the attention. You don't want the attention to be on you. But I
Hmm.
think, at some point you realize, well, I think I need to speak out because I need to show people that it's so common that it does affect people, and I'm somebody who has Hep B and has to struggle the same way, my patients are. And I, at that point, I would occasionally tell a patient if I felt like it would help them, like people who felt really distraught,
Hmm.
like they didn't have hope. And I would say, hey, I've got it too. And this is how I manage it. And I could see it would light
Right.
up. Their eyes would light up like, oh, I'm talking to somebody who understands me. And so I
Do
would
you think?
selectively share with people.
Do you think whether at the beginning, I'd love to ask whether your parents were, we often hear when I'm in the community that parents are saying, like, hush, hush, don't tell people this. I don't tell people this. I think we'll be treated. worse, and I can tell a distinct story that really has left an impression on me. We had a couple advocates who said, "Oh, I'll come on this series and talk about it, or go on an interview on Chinese radio," and they were fine. They tended to be a little bit younger, in their 30s or 40s, and say, "Oh, it's important that we talk about it," only to come back later and say, "I'm really sorry, Richard. Um, I can't do the interview anymore because my parents are worried about
Yeah.
being seen as the parents of this person who has Hep B, and they're older seniors now, and I don't want them to be upset or be discriminated against in their community." And so I'm wondering what your family's perspective, both siblings and parents, and if you felt some of that, negativity that often comes or people are afraid of.
Yeah, I mean, this is a real issue, I think, and it's interesting what you shared that this has happened, to you, and obviously people have to respect that. You often think about your own story only, and it's like such a big deal for you to come out, but then you almost forget like there's fallout, right, on the people around you,
Hmm.
especially for something because it's a transmissible disease, right?
Hmm. Hmm.
So I think I've been just really fortunate again that my family's been supportive, but yeah, I think at some point it did come up when I shared my story. It's something that was kind of public, and it was something where I was talking about my mom. And I feel like there was like a twinge of like, oh, she like didn't want it to get out widely, but and it
Hmm.
turned out she doesn't have Hep B anyway, so
Right.
it became less of an issue. But we at that point had thought I'd gotten it from her.
Hmm.
Um, so yeah, I think it has crossed my mind for sure.
Okay.
Um, and I think, you do have to be sensitive, right? So obviously if somebody had mother to child transmission and they talk about that and then their mom's, up there and like all of a sudden her friends all know, right? So I get it
Hmm.
that people feel like, it's not just your story you're telling, right? It ends up
Yeah.
reflecting on family members. So people have to be sensitive about it. And I think it's important just to remember like people have to tell their story, up to what they're ready, right? So everybody's on a different journey in terms of what they feel comfortable divulging and who they're comfortable divulging it to, right? So you
Hmm.
may be comfortable in a certain group, but that doesn't necessarily mean you're comfortable telling everybody. And so I do think it's important for us who are people who are allies of people with Hep
Hmm.
B to always let the person with Hep B, like they need to be the ones to decide who they tell and when they tell,
Right.
to double check
Right.
with them. Like you may have seen this person like tell a large audience about it, and so you think it's okay like in some other setting to like just say right away that that person's living with Hep B, but there may be things that you're not aware of or why they're not comfortable with that
Right.
audience knowing.
Right.
So you can never go wrong double checking with somebody, hey, is it okay if we talk about you having Hep B? Or just like
Hmm.
you did, kind of living, leading in like, hey, how does Hep B affect you? Letting me
Yeah.
kind of share what I feel comfortable sharing. Like that's super important and like very respectful the way you did it. And I think, yeah, it's just, it's important for people to feel like they control that messaging. Um,
Yeah.
but yeah, so you bring up a really important point.
Yeah, I think for those of you listening who have maybe not seen an episode before, I think it's really important to stress that living with Hep B isn't a death sentence. It really hasn't been for the longest time. There's not only good management, which some folks will come and say, "Oh, I don't know, am I going to have to take drugs nonstop, or is it like kidney dialysis?" Right now, it's March, April 2025. The treatment or the management of hepatitis B, even if you do find yourself infected, is just visiting your physician twice a year for some certain blood tests and maybe an ultrasound of at least once a year. And for a full 50% of patients, they just do that through the rest of their lives and they won't have to start medication. And it's just kind of like an extra checkup. So nothing crazy, nothing super intrusive. And then for the other half of patients, sometime it could be that first visit, it could be 10 years later, it could be 20 years later, some of those numbers might not look good, and then the physician might suggest that you start on treatment, which is currently a pill a day, very little side effects, often covered by insurance, and there are also some kind of solutions and
They're
options for those who,
generics, right? So they're out of
yeah,
pocket now. You can pay out
that
of
are
pocket even if you don't have insurance,
right,
or
that are
like,
not crazy expensive. And so then it's like we've talked to patients who literally go, I take it as if it's like a vitamin a day.
mm,
And my liver has health has gotten better because the liver is one of the few organs that regenerates, and people are fine. So definitely something that, though of course is not something you maybe want to share right when you meet someone, is not something that's going to be crazy. And then in additionally, people are always worried about protecting their partners, their loved ones, a new sexual partner. And as Dr. Wang said, simply getting the those close to you vaccinated will protect them for life, and is very simple, also covered under all the insurances, Medicaid and Medicare. So lots of easy things to know. And then finally, we haven't covered this at all, but for those who don't know how Hep B is transmitted, it is through blood and sexual fluids, but not through sharing food, coughing, sneezing, talking, touching. And so we have often tackled that as myths, especially with many immigrant families where unfortunately they just don't know or they're suspicious and they think it comes from food or water. And so we have this story where a person came up to at one of the educations and said, "Oh yeah, like my uncle has this. He lives in the same house, but he lives in a separate part of the house. He uses a
mm,
separate
so sad. Yeah.
bathroom and he eats by himself." And you can imagine how isolating that might be and discouraging, and especially with the fact that that's totally not needed.
Yeah.
Just having the family vaccinated. And so I just wanted to remind folks of that information. I'm wondering, so you had said that it never really affected your career, but in terms of like you being qualified or your peers being discriminating on you, do you think you just got lucky there, or was there a policy when you were training or anything like
Yeah,
that?
I think, I mean, from what I've gathered, like having seen this happen to other people,
Hmm.
it is kind of random. I mean, I think, and it probably depends on if your institution had a policy or not. I mean, now at this point, since there's been a couple of cases that led up to the Department of Justice getting involved and Hep B being declared a disability, so it's protected
Hmm.
status. So people cannot be discriminated against based on their Hep B status, and that's important for people to know out there. I think it's important for us advocates to
Hmm.
ensure that if you hear of any cases of discrimination based on somebody's Hep B, that it's reported. So if it's with work, like the Equal Employment Office, if it's with school, all these can be reported, like for ADA and such, under ADA. So this was, I think, a lot of schools when this happened who did not know what to do, and they brought in the lawyers. And so we've seen a couple of really awful treatment of students where the lawyers said, you can't be. I mean, it was a letter from the school, but it was very, um, basically they said you're a hazard to yourself and others.
Right.
We can't
Yeah.
accept you, and we've rescinded your acceptance or whatever.
Hmm. Hmm.
Um, and so I think it's been kind of a case by case scenario. Obviously, after the agreement, I mean the settlement and this, you know, basically what's happened now is more of a policy. And then the DOJ actually did send out a letter to all the schools, basically saying, you need to follow this. I think that's
Yeah,
really
you can't
helped
do this.
set the
Yeah.
standard. But prior to that, it wasn't there. So I do think, in some ways, maybe I was lucky. Like I think, you fill out all this paperwork and people are reviewing it, and maybe like it just wasn't seen, or because basically what they're looking at is, you're supposed to report if you're immune or not to Hep B, and obviously those of us with Hep B are not immune to Hep B, and
Right.
so there's no point in giving us vaccines.
Right.
So there are a couple of things that would trigger, somebody in a school to take a closer look, and or maybe some people just knew, and I don't know what happened, but
Hmm.
I'm glad like
Hmm.
it did, because what happens as a student is even more challenging than I think what happens to somebody who's just showing up to the doctor and got and got tested positive because all of a sudden, you've got your dean who knows, you've got, people that you're doing rotations, your
Hmm.
attendings who are giving you review, who are evaluating you, all of a sudden may know your status because they may second guess you going to the OR or like doing certain
Right, right.
rotations. And if you have a review panel, all of a sudden these people who are part of evaluating you now know your very personal medical history, right? And I feel like
Hmm.
it's very unfair for somebody who's a student because, there's a power differential and you're very vulnerable. Everybody else is protected by HIPAA, right? So, like, you're not supposed to know if I have
Right,
whatever diabetes. I mean, whatever medical thing, like
right.
my job, they're not supposed to necessarily know this, but all of a sudden there's that like vulnerability that's been exposed.
Yeah.
So I think it's not easy for a lot of people. There have been cases I remember hearing about a story of a cardiovascular surgeon who was um, basically found out she had Hep B during pregnancy um,
Mm.
because, certain, like for employee health, you're supposed to submit that you've had Hep B vaccines, right?
Right,
Not every employee health will also test you for surface antigen. So if
right.
you've been vaccinated, but you've never had a surface antigen test, you easily could be thinking you're walking around immune, but you actually have Hep B, but nobody ever bothered to test you. So this
Hmm.
woman basically had never been tested, but became pregnant. And as part of prenatal screening, she was found to have Hep B. And then
Right.
she got a viral load. It was extremely high. She did surgery. And so all of a sudden everybody, got all like, oh my gosh, like they pulled her out of the OR. And she had to go through this whole thing of being evaluated by this expert review panel. And the
Hmm.
recommendations by SHEA, the Healthcare for Epidemiology, and CDC are that if you're doing level 3, category 3 procedures, so basically it doesn't matter if you have Hep B, if you're doing like me, outpatient medicine, right? I don't have like any exposures that would risk, put patients at risk. But if you're doing level 3, category 3 procedures where you are doing invasive surgery to the point
Hmm.
where your fingertips are not visible, because there's some small chance that if you're doing surgery, you might nick a glove or something and there might be exposure. Those are the folks that we do have recommendations where they should be on medication to keep their viral load low,
Hmm.
just to like protect in that very small chance that there's some sort of, accidental
Right.
exposure. But everybody else shouldn't really be treated any differently beyond what is like kind of already clinically recommended for you.
And
Um,
that just to jump in here, Dr. Wong touched on something that I think is important for folks to know, which is, well, as advocates, we always say get screened, get vaccinated. But in many situations, the kind of norm is to just go get vaccinated. And we get that as public health folks, we get that because your ability, your bang for buck in terms of
mhm.
these big campaigns, it's like get everyone vaccinated because that way everyone is protected. And there's a small portion that have this disease already that the gold standard we say is to test everyone first because you don't want to create this situation that Dr. Wong just said where someone thinks they're protected and
Yeah,
then might accidentally infect someone because if you get vaccinated when you already have a disease, that vaccine does not cure you, it just is preventative. And so, for everyone out there, we really suggest that the best thing to do is to get screened first so you know that whether you have the disease or not, and then get vaccinated. But there are a lot of times, like I think a lot of the school initiatives I remember, I think back in elementary school, we were required to show proof of vaccination for
mhm.
Hep B to go to public school, but I don't think we were required to show proof of testing.
Yeah,
I
no,
could be
definitely
wrong. It
not.
was when
Yeah.
I was really young, but that is really important. So, our action calls, we'll say it at the end of this call, is to just get tested today. It's covered by almost every insurance, and then you'll know. And then if you do have the disease, there's lots and lots of resources. And if you don't, you just get vaccinated, also covered by everything, and you're safe for life. So just wanted to throw that in there.
That's a great message. Yeah. Yeah. And then I love your message about like how if you have Hep B, it's not a death sentence. You can live a totally healthy, happy life, just like anybody else. I think it's just really important to stay connected with healthcare, make sure you're seeing a doctor, for Hep B, and it could be a hepatologist, a GI doctor, infectious disease doctor, or
Mhm.
a primary care doctor like me that has experience in taking care of people with hepatitis B. Or it could be a combination, like you might see a hepatologist for an evaluation.
Mhm.
Don't, the decision is not to be treated, but you can still, with your primary care doctor, get your viral load, your ALT, AFP tested every 6 months, do your liver cancer screening with an ultrasound, and that can be ongoing, and then if something changes and they're not comfortable, managing you, then maybe see the hepatologist or this expert again.
Yeah. And you can have a full, healthy family, children, and everything. That's a
Yeah.
question you get a lot. People are like, oh no, like, I got this from my mom at birth. Like, will I give it to my children?
Yep.
And fortunately, now with medication and prenatal care and postnatal, I mean, when the infant is born, get them getting what's called HBIG, or essentially a big dose of the vaccine, has stopped that cycle. And so since about the mid 90s, if I'm correct, they've been testing in US hospitals, they've been testing pregnant mothers for hepatitis B, along with lots of diseases that they don't want the infant to get. And if the mom has it, just like you're talking about this cardiovascular doctor, the mom will be put on treatment. And right when the baby is born, the baby gets a dose of
Hep B
essentially a
vaccine
vaccine to
and the
prevent that.
HBIG.
And so
Yeah.
now infection rates for infants born in the US, I think is less than 1%. It's like very,
Yeah.
very so.
It's really low. Yeah. So we
So I
have, I
think,
mean, in the US, we've been doing birth dose since 1992. So that's
mhm,
all babies. Well, since 1992, we've been giving infant vaccination. So it's now part of the vaccine schedule for all babies. And
mhm,
then birth dose is now recommended for all babies within 24 hours. And that's been adopted by American Academy of Pediatrics. WHO has
mhm,
been recommending this for a while. And there's a whole campaign, to have hospitals doing this as part of routine care. And there's a birth dose honor roll, for hospitals to try to get their numbers like over 90% or so. And we were, I don't know, I think in the US it wasn't amazing. I think we were like 69% for a while. I think we boosted it up since it's become a recommendation.
mhm,
But yeah, I mean, I've got 4 kids, and this was definitely on my mind when I was pregnant. It was like another time when I was like, oh, all of a sudden this personally affects me. Like, I do not want
mhm,
to pass this on to my kids. And my viral load was low, so I didn't need tenofovir for treatment. But if your viral load's over 200,000 during pregnancy, it is recommended that you go on tenofovir during the second and third trimester to reduce the risk of transmission. But honestly, with the vaccine, the birth dose within 24 hours, and then HBIG, ideally, actually, the sooner you give it after delivery, the better. So in a lot of hospitals, it's like within 12 hours is ideal.
right.
The immunoglobulin is just like protective antibody to help the baby at birth, because it takes a little while for the immune system to develop antibodies from the vaccine. And not
Right.
all countries have it. HBIG is expensive. So in a lot of lower middle income countries, they don't have HBIG, but the data shows that even if you can get birth dose pretty early, most of these babies are, well protected. And if you combine that with tenofovir, if the mom has high viral load, then you really, really reduce the risk of transmission. So yeah, we've got some amazing tools. So I think nobody should
Yeah.
feel like they cannot, you know, have a family, get pregnant, and these are all really success stories, of the Hep B
Mhm.
of the Hep B story, basically, like, that we have all these interventions, and really it's just about making sure we get the interventions to the people who need it. So this is where public health is really important, right? All these important campaigns and recommendations, for people to follow.
Yeah. And I will address two things here. One, if all of those names of drugs and acronyms confuse you, don't worry. You can, at the end, we'll give our phone number where you can get help. And then lots of, you can speak to your doctor. A lot of that stuff is very distinct to understanding it, and your doctor should be able to explain it. And the other thing I have to cover in this kind of crazy time is kind of vaccine skepticism and some comments that have been made about the Hep B vaccine. As we have said, it is both a disease that's transmitted through blood, but also sex. And so you'll see in social media, why is it that my infant needs a Hep B vaccine? My infant's not having sex right when they're born. And it's just a misinformation kind of soundbite. Obviously, it is mostly in the world, 90% of Hep B is transmitted through mother to child transmission, most often when the mother does not know she has Hep B. One of the important things we also haven't covered here is 90% of patients with hepatitis, chronic hepatitis B, don't have symptoms until it becomes late stage liver cancer, which usually doesn't occur until folks are 50 or 60 or even older. And so you have the mothers who often contracted the disease from their mother at birth who have not felt sick their whole life. And I think Dr. Wang, I think when you found out when you were donating blood, you had never felt sick from it
No, yeah, I
either,
felt
right?
fine.
And
Yeah, it's
so
totally fine.
and so when we say we're vaccinating infants right at birth for Hep B, we want them to not get the disease later on unknowingly, or we're trying to make sure that if they are born and for some reason the mother hasn't been found out to have Hep B, we have another layer of protection on making sure that doesn't transmit. And so I just wanted to make that clear. And of course,
Yeah,
the vaccine for a long
I think if
time.
parents really think about like what you're doing, like the fact that the Hep B vaccine is a cancer preventing vaccine, right?
Right.
That's
Right.
huge. I mean, if I could prevent my child from having a risk of cancer, like why wouldn't I do that,
Yeah. Who would say
right?
no to that? Right.
Who would say no? And so I think, yeah, a little bit of like these, misinformation, smoke bombs that are being, put out
Hmm.
there now, unfortunately, becoming very, confusing for people. Like you're saying, why do we need this? This is an STD, my baby's not having sex, that kind of thing. We've definitely heard this over the years. This is not new. But it comes out of the fact people don't understand the disease. They don't understand that it's largely mother to child, but not even that. I mean, I think there are people who get Hep B and never know how they get it, right? And like
Right.
there's father to child transmission people to talk about, like dads can get it, and sometimes it's just very small risk. Like sometimes it's just exposure of blood at home, it can be through wounds,
Hmm.
right? And why, when the babies are just not, even though they get the vaccine, their immunity is not as good as adults, so it's less likely to horizontal transmission if your immune system's intact. But for infants, like we just know that the earlier we can vaccinate, the earlier the baby gets protected. And the key thing I think a lot of people don't know is if you get Hep B as an infant, you're much more likely for that infection to become chronic, which is what I have, chronic disease. If you were to get Hep B as an adult, your immune system often can fight it off and you become immune. But
Hmm.
when you're young, when you get Hep B, your immune system just thinks it's part of yourself. And so it doesn't mount a
Hmm.
response, it doesn't try to clear it. And so those of us just like end up with Hep B for the rest of our lives, at least until we get more curative therapies. And so, yeah, why wouldn't you give your baby a totally safe vaccine to prevent them from getting a chronic infection that could get liver cancer? I think most moms would jump at that opportunity. And even if you don't have Hep B, like I don't know and I mean, we've heard crazy stories where like babies got into a bad car accident, they needed a transfusion. For some reason, this transfusion wasn't like cleared of Hep B, somehow didn't get screened,
Hmm.
and they got Hep B from a transfusion,
Yeah.
or it might have been some iatrogenic thing, like they had a cut, or they were exposed to somebody who had it. And actually in Africa there's a lot of horizontal transmission that happens child to child in kids under 5, because a lot of times they're not wearing shoes, they get cuts on their feet from like running barefoot. Kids when they're young, they're like horse playing, they're like biting each other. There's
Yeah.
just exposures we don't think about that may be less likely in our environment but still are out there. And so
Hmm.
it's, I think most parents would just say, hey, yeah, I want to protect my kid from that. Like, I just don't know, right? We don't have 100% certainty of
Yeah.
everything your kid is exposed to or everybody that they're exposed to. Sometimes you
Yeah.
have visitors from outside, you have, people that, taking care of your kid and you don't know their status. And not to say we should be fearful about that, but like if you have something that works and it's pretty much almost 100%, why wouldn't you protect your kid from that? We use helmets, we use seat belts and other things to prevent against risks that are sometimes considered very small, but now considered like, when you look at the public health, risk versus benefit,
Yeah.
like we
Part of the
know that the
norm.
cost is worth
Yeah.
it. So I think if we pitch it that way, then people kind of get it better. But we're getting a lot of that misinformation right now. And so we have to combat that. Those of us who are in the community and, can do health education, this is something we have to get out there to like, correct the balance of
Mhm.
information again.
And Dr. Wong was just talking about how, like, the infection, and I realized I haven't rattled off what I call the scary but important facts, which is approximately 1 in 12 Asian adult immigrants in the United States has chronic Hep B. This is as opposed to about 1 in 1,000 of the general populace. So it's a huge health disparity. That's why we talk about it a lot, and that's why so many Asian immigrants and Asian Americans have Hep B. But two-thirds, it's estimated that two-thirds of those people who are infected don't know it because, just like Dr. Wong, they never feel sick. They got it at birth or right when they're young. They feel fine. And then tragically, they only know that they have Hep B when it becomes liver cancer. And about 1 in 4 folks who have chronic Hep B will develop a late stage liver disease that causes them serious harm or death. And in general, you are 100 times more likely to get liver cancer if you have chronic Hep B than without. So this is, in that sense, sounds really scary, a serious disease. But at the same time, what Dr. Wong just said, with a quick vaccine and early testing, I talked about management earlier, and I believe the stat is still somewhere between 80-90% of folks, if you catch their Hep B early before it has become any sort of serious liver disease, live on to have full healthy lives. And so this is for
Yeah,
us.
I mean, we don't have good long-term studies on
Mhm.
this, so but I would say at this point, all end-stage liver diseases and cancer are pretty much preventable if we catch people early enough and
Mhm.
we can get them on treatment. And that's the thing, is that a lot of times people are seen by a doctor and they may be at a stage where it doesn't look like they're having problems in the liver, and they're kind of told you don't need medication. They
Mhm.
maybe remember being told they, are a carrier, and they don't prioritize, being seen, and they kind of go off, they disappear. We don't see them again for
Mhm.
several years. And at that point, the liver disease, it's a dynamic infection. At that point, things have changed, right? So maybe there
Yeah.
is inflammation, or, maybe they have waited too late. And we don't know the exact percentage, but I think a lot of hepatologists or people who are in the cancer spaces will say, I'm still getting liver cancer cases like that are diagnosed too
Mhm.
late. Like, I've definitely heard of people
Yeah.
who didn't know they had Hep B at all until they found out they had liver cancer. And at that point,
Yeah.
starting antivirals is definitely too late.
Too late.
So, I think there's no reason somebody cannot, that we can't prevent it if we see people earlier enough and start treatment. I think there's evolving movement to really get people on treatment earlier.
Mhm.
Um, there's a lot of debate and controversy of whether everybody needs to be treated, and I think people's scenarios can be very different. There are people who have really kind of what we call inactive disease, like maybe don't even have detectable viral load, and liver enzymes have been totally healthy. Like, the benefit of them taking medication may be different from somebody who's got abnormal liver enzymes and has a viral load
Mhm.
that's like up 20,000, 200,000, or millions,
Mhm.
like, so the benefit may be different, but I think, this is my personal opinion, I really think everybody should be offered treatment, if they have any
Mhm.
kind of viremia or if they have Hep B. And people just have different motivations. And I think patients' preference and values, what's important to them, should be equally important as what
Right.
the clinical scenario looks like and what the liver society recommendations are. I think there's a movement, and we're going to see this in the newer recommendations, where we want shared decision making. AASLD just put out some proposed recommendations for the new guidelines, open comment right now until May 6th, that basically has some recommendations, and you'll see the language of shared decision making. So this is a really important
Mhm.
time for us to educate
Great.
the community and say,
Yeah.
hey, make sure if you want to be on treatment, there's no reason you cannot request it and be put on it.
Yeah.
Like, your doctor may have said, we thought you didn't need it, but if you want to be on it and you're motivated, you want to prevent liver cancer, you're worried about transmission, that is equally important. And you're going to be adherent, you're going to be compliant, take your medicine every day. I think there are very few doctors who would say, I'm not going to give it to you. But you have to
Mhm.
vocalize it. And as well as I do, that a lot of us in the Asian community may still kind of have this feeling of like, oh, the doctor's right, I will defer.
Yeah.
If they think I need it, they would have told me. And I'd say, nope, you got to be an advocate for yourself.
Yeah.
We are in the time, doctors are busy. Not everybody knows Hep B as well as other people. there is no reason you cannot verbalize and be an advocate for yourself and say,
Hmm.
hey, I want to do something about my Hep B. I know you don't think I'm, in danger. My liver, my Hep B may not be super active, but I would prefer to not have the risk. And I've had these conversations with patients, and they'll say, yeah, I've got little kids. Like, I need to be around for them. And if you're telling me, I mean, some of the stats out there I think are kind of concerning, but really show you like Hep B is an oncogenic virus. It is, somebody recently told me that it is classified as a, what do they call it? Carcinogenic entity. I think IARC,
Mm.
this group that like identifies carcinogens, actually has Hep B as a carcinogen. Um,
Mm.
and there's some stats saying that it is, how we all think of smoking as leading to lung cancer, right?
Right. Right.
Hep B, the strength of Hep B leading to liver cancer is even stronger than the link of smoking to liver cancer. So if we're
Wow.
all about like, prevent secondary smoke exposure, right? You can't even go to a bar anymore,
Right.
right? Why would we not be as proactive of this carcinogen that leads to liver cancer?
Right.
And I just think there hasn't been that kind of movement, campaigns, money,
Yeah.
for us to be at that point. But if you tell the average person with Hep B about this, they would be like, yeah, I think this is my life. I only have one life, right? You may be like
Yeah. Yeah.
public health, like it's not worth the money for everybody, but like if I have control, I'm willing to pay for it, willing to
Yeah.
take it. Why wouldn't I do that? I
Hmm.
think then the proposition changes a little bit at that point. And especially when we see people who are really worried about Hep B and they're told by their doctors they don't need medicine, but these patients end up spending money on herbals and supplements that have not been
Hmm.
shown to make any difference on the viral load, cost money, and some are quite expensive, more expensive than the generics might be, like the medicines, and potentially can harm your liver, because some of
Hmm.
these have not been really well studied. And so, that definitely doesn't make sense to me. Why would I, as a doctor, say, sure, take these herbals because I don't want to give you antivirals, when you could be taking an antiviral that's generic, less than $20 a month if you don't, even if you don't have insurance, and
Hmm.
actually works. Like it actually will suppress your viral load, stop the inflammation. I think at that point, we in the medical community need to step off our high horse of like everything has to be super data driven and
Hmm.
recognize that like our data is not, we don't have as many studies as we'd like to because there just hasn't been the funding, and just recognize that like patients have equal right to be in control of their journey, and we should not be withholding the medicine, from
Yeah.
patients, if it's a tool that we have deemed as safe and as effective. And so I think this is an important time for us in the community to really support that patient journey and to enable and to let patients know that this is this is something that they can have as a tool, and not be shy about asking for it.
Great. Well, I want to get this to wrapping up. So I wanted to ask, I love this question, which is, what would you say to someone who is just finding out that they have Hep B, or perhaps maybe someone who's worried that their brother or sister or mom or dad or aunt or uncle has it and really doesn't know where to start with all of this?
Well, I would say that, now's a great time. I think, now you're walking into, um, a strong community of support, right? We've got a lot of patients who are out there visible talking about it. There are online communities where you can get a lot of information from other patients. Check out hepbcommunity.org. There's a
Hmm.
lot of questions that people have that they're not necessarily asking their doctor about, but are asking each other about, like how to navigate relationships. There's a ton of great information. Hep B Foundation has a lot of information kind of geared towards, patients, but CDC and a lot of medical, information out there. A lot of doctors out there, who are able to help. And with the internet, like even if you live in a remote area, there's still a lot of resources kind of at your tips. Obviously, a lot of community groups like, Happy Free, and look for a community group. If you go on hepbunited.org, you can look up to see if there's a community organization near you, to get support. So I think it's just about like connecting you to people, and to find that support. But it exists. I think 10, 15, 20 years ago it was sparse, and people did feel alone and, didn't have as much access to resources, but it's there now. I think it's just a matter of looking for it. And I think when people hear stories of other people who are living healthy, happy, lives, and it gives them hope. And there's no
Yeah.
reason people should be really upset about it. Obviously it's not something you wanted for yourself, and it can be challenging, but it's not insurmountable challenge these days. So, and it's people like you who kind of keep continuing to build that community that are really important. We want to get people connected to.
Yeah. Well, thank you so much for your time. In terms of action items, please just get tested. Super easy. What we always say is just call your doctor or email your doctor if you don't know your status, and then you can schedule the vaccine. As Dr. Wang just said, you know, I think when it first came out, it was the Hep B vaccine was like the first anti-cancer vaccine because of what you were talking about, or set called that. And so, why wouldn't we want to do that, especially if it's covered? If you're looking for resources here in the Bay Area, you can always visit us at sfhepbfree.org. That will be in the show notes, as well as you can call us. We have a helpline that's at 415-336-2629, and you can leave a message and someone will call you back. That is in English, Cantonese, or Mandarin. You also have some wonderful clinics that are safety net clinics, like Northeast Medical Services, which serves in San Francisco and parts of San Mateo County, Chinese Hospital, and Asian Health Services in Oakland. All of them specialized in Asian immigrant populations, as well as just going to see your Kaiser doc or whatever physician you have. Please note that the Hep B test is not part of your annual physical. We get that question a lot, at least not yet. And so you unfortunately kind of have to often advocate for yourself to get the test. And so you'll need to ask your doctor specifically. I think that pretty much wraps it up for us here at Living with Hep B. Dr. Wong, thank you so much again for your time, and I'm sure I will see you at some meetings or trying to do more advocacy stuff.
Yep.
Um, if you are watching and want to get more involved, you can also call all those numbers or visit our site and volunteer or donate. And if you are listening from the East Coast, you can also and are in the New Jersey area. There's lots of work being done there, or in the New York City area with the Charles B. Wang Clinic as well. So thank you again, Dr. Wong, and I will talk to you soon.
Yep. Nice being here. Thanks, Rich.
Yep. Bye, everyone.